Hello everyone, my name is Zach Hansen. I'm a physician assistant working alongside Dr. Kurtis Staples for Sonoran Orthopaedic Trauma Surgeons in Phoenix, Arizona. Today, we're going to walk through what you can expect, and most importantly, what you can do to prepare yourself for a successful hip replacement. The better prepared you are before surgery, the smoother your recovery will be. Let's begin with why we are replacing your hip. The most common causes of cartilage damage in your hip joint: osteoarthritis, avascular necrosis, fracture, and dysplasia. With a structural problem in the hip joint, we offer a structural solution. When that cartilage is gone, bone rubs on bone, leading to pain, stiffness, and a significant decrease in quality of life. Hip replacement is a very reliable structural solution for that problem. In order to proceed with surgical planning, we need patients to obtain medical clearance. You will obtain medical clearance from your primary care provider and other specialists if needed. Testing may include blood lab work, urinalysis, EKG, chest x-ray, and sometimes cardiac stress testing if you have a heart history. We coordinate this process carefully with our surgery scheduler so everything is completed and reviewed before your surgical date. This way, patient's health is optimized for a smooth and successful surgery. Besides just lab work and testing, here are other things that we recommend to maximize your health going into surgery. If you are diabetic, blood glucose needs to be under control. At a minimum, your A1C should be under 7.5 to 8. If you smoke or vape, we recommend stopping at least 1 month prior to the procedure. Lastly, if your BMI is over 35, we recommend as much weight loss before surgery as possible. We understand these changes can be challenging. We're here to support you and coordinate care with a primary care doctor, physical therapist, or nutritionist as needed. Everyone has a different medication requirement and supplement regimen. Here is our advice for your upcoming surgery. Stop all anti-inflammatory medications at least 2 weeks before surgery. Those include ibuprofen, naproxen, or aspirin. Additionally, we ask that you stop all supplements 2 weeks prior to surgery, especially those supplements that contain the following ingredients. Continue other medications unless otherwise directed by your pre-operative team. These medications mentioned significantly increase bleeding risk during and after surgery. In short, you may continue your regular daily medications unless we or the pre-op medical clearance teams specifically tell you to hold them. One of the most powerful things you can do right now is prehabilitation, sometimes called prehab. Research shows that patients who start or continue a structured strengthening program before surgery tend to recover faster, have less pain in the first few weeks, and reach functional milestones sooner. Start or continue a preoperative physical therapy program. Upper body strengthening, core strengthening, lower body strengthening can all be included within the parameters of these programs. Maintain activity via a stationary bike or even pool therapy. Lastly, walk. Regardless of your exercise, stay active. The goal is not to become a bodybuilder, it's to maintain strength and conditioning so you're starting a few steps ahead. Now, let's talk about your home environment. This is a practical and impactful thing you can do now in preparation for surgery. Avoid trip hazards, remove throw rugs, secure cords, improve lighting. Bathroom setup: grab bars, shower chair, toilet seat riser. Stock your freezer or your fridge with easy to prepare meal options. Set up a recovery station, a phone charger, remote, water, medicine, all within arm's reach. If you think you'll need any of these items, let our office know. We can write a prescription for durable medical equipment that is usually covered by insurance. Small preparations like these make the first couple of weeks much more productive and successful at home. Next, let's discuss realistic surgical expectations. Surgery takes on average 40 to 60 minutes. Swelling and bruising in the operative thigh and leg is common. Given the direct anterior approach, patients may experience nerve irritation and numbness in the thigh. This sensation will diminish as healing progresses. The first 3 weeks following surgery is the hardest part of recovery. Don't get discouraged. Now, what happens following surgery? The majority of patients go home the same day as surgery. Ensure that you have adequate help at home during the initial period of recovery. 1 to 3 weeks is pretty typical. If needed, arrangements can be made to stay overnight at the hospital or go to a rehab center after surgery. We'll discuss with patients and family what is the safest and most realistic option for each individual situation. That's the overview of how we prepare for a successful hip replacement together. The most important message I have to leave you with is this: you have a lot of control over how smooth this process can be. The work you do now, optimizing your health, strengthening, preparing your home, following medication instructions, pays huge dividends during surgery and into your recovery. We're honored to be part of your team, and we're here to answer questions at any point along the way. Thank you again, and we are looking forward to getting you back to a more comfortable, active life.